Hi, my name is Nicola, and I am going to be talking about my poster, which won the Best Poster Award at ESPID in 2019. I have no conflicts of interest and nothing to disclose. And this is a copy of my poster from that year, entitled Clinical Presentations and Etiologies of Fever of Children in Nepal. This small research project was embedded within a much larger research study. So I was working at the time on the TIVAC Nepal study, which is a double-blind randomized control trial of a typhoid conjugate vaccine, whereby we vaccinated around 20,000 children in a 1-to-1 ratio to receive either the conjugate vaccine or a control vaccine. And as the efficacy measures of this vaccine, we established a number of passive surveillance clinics in the area of vaccination. At these clinics, we were asking all participants to attend if they had any symptoms of fever. And this was so that we could collect blood culture data to determine whether the vaccine was effective or not. Fortunately, an added benefit of this setup meant that we had a large number of children presenting to a number of clinics within this urban area of Nepal, which provided us with a lot of data regarding the clinical presentations and the causes of fever in this population. So within around a 17-month time period, we had a significant number of presentations to our clinics, over 2,500, of which the most common reason for presentation was upper respiratory tract infections, which is not surprising in a childhood population. The other findings of note were that of all the blood cultures taken, the most significant growth was of Salmonella typhi, which was quite notable for the purposes of the wider trial. Most of the children were generally very well, and only a very small number required hospital admission, although around half of the children presenting did receive antibiotics. So just as a quick update on how things have gone since then. So the community surveillance clinics did have some difficulties in 2020, understandably, as community activities became quite difficult with the ongoing pandemic. However, there has been an additional year of data collection on fever presentations and diagnoses in these clinics. And one of my colleagues from the project, Dr. Diksha Panth, has produced a poster which is at ESPID this year, entitled Clinical Presentations to Fever Clinics in Nepal. So I would very much encourage you to check that out. As part of the wider vaccine study, there was an interim analysis towards the end of 2019, which showed that the typhoid vaccine was safe and effective, which was great news not only for the study, but for the wider world. And this data has already been used to influence vaccine planning globally. So I would like to end there and say thank you very much to everyone at ESPID and also everybody who worked with me on this project. So thanks again. Goodbye.